Are your toenails growing more slowly on your feet? Have you noticed that your legs have sort of a different hue? Maybe they're a bit more pale or sort of a bluish coloration. Or maybe the skin on your legs is shinier than you remember it being in the past. Or what about the hair on your legs? Is it thinning or is it growing more slowly? All of these and more could be potential signs that you have poor circulation in your legs. This is a really important topic. I'm giving you the signs and symptoms of potential poor circulation in your legs and feet. Guys, I'm Dr. Jen Caudle. It is good to see you. Now, I want you to watch to the end because I'm going to give you, number one, the most common symptom of poor circulation in your legs. You're not going to want to miss that. And also, number two, I'm giving you a really unexpected but important sign or symptom that men can have in particular that may indicate that you have poor circulation in your legs. All right, before I get to more symptoms though, just so you know, when we talk about poor circulation, by the way, you can have poor circulation almost anywhere. You can have poor circulation in your arms and other places. We're focusing on poor circulation in your legs and feet. Oftentimes this is called a peripheral artery disease or peripheral vascular disease. Again, that can happen in other places, but we're focusing in the lower extremities. Guys, this is really important because when we talk about peripheral artery or vascular disease, oftentimes the cause is that you've got some either narrowing of the arteries, often due to plaque. See, remember, blood needs to flow through our arteries because blood brings oxygen and nutrients to our tissues. It is very important. So if blood can't get to our tissues because the arteries are narrowed, well, it can cause changes in our body that we see. Slower growing nails, changes in our skin, hair issues, and some of the other symptoms I'm going to mention. So that's why this is so important. But it's important because, by the way, this affects your overall health. Risk factors for peripheral artery and vascular disease, again, we use those terms interchangeably, can be things like smoking, diabetes, cholesterol, high blood pressure, so many other things. But let's go back to the signs and symptoms. And again, if you notice these signs or symptoms, you got to see your doctor right away to be tested. There are tests that we can do to see if you have peripheral artery disease and then be treated. Because if this is not treated or intervened on, it can lead to really, really bad consequences, some of which I'm going to name. Okay, other signs and symptoms that you have peripheral artery disease or poor circulation in your legs. Number one, wounds in your lower extremity. Just the presence of having them could indicate that you have poor circulation. Not only that, wounds that don't heal well. A wound that you've had that just won't seem to go away or heal. That is something we always pay attention to and often can be literally a red flag. The other thing, we talked about change in skin color. Let's talk about temperature, okay? If you touch your feet and you're like, oh gosh, they're cold. They're cold all the time. The lower legs, they're cold. Your feet are cold. No, you got to see us about that because that could be a sign that you have poor circulation. Also, pulses. If you don't, and you may not be checking your pulses down there, and I'm not necessarily expecting you to, but I'm just throwing this out there. If you know how to check the pulses in your feet, and you check them in your lower legs, you check them and you either don't feel pulses or they are very weak, it could indicate that you have poor circulation. Because again, a pulse is sort of representative in many ways of blood flowing through the arteries, and you sort of feel that sort of pulsation. If you don't have a pulse, it could mean that the blood flow is not going through the arteries very well, likely due or often due to plaque buildup, okay? Other things is, and literally the most severe consequence, one of the most severe consequences is tissue death or gangrene, okay? Now let's go to the two things I told you I was going to tell you at the beginning. Two things I told you I was going to tell you at the beginning of the video. Okay, well, welcome to me, okay? The most common, though, symptom of peripheral artery disease or poor circulation is something called claudication. And honestly, this is the symptom that often brings people to me. What it is you feel cramping in your legs or your thighs or your buttocks when you are active, when you're walking, when you're exercising, you're climbing steps, whatever. You feel cramps when you are moving, when you're active. And then when you rest, you sit down, you take a break, you're sedentary for a while, that pain goes away. That has a name. It's called claudication. That is very likely the most common symptom of poor circulation to the lower extremities. So you got to keep that in mind. And again, that can happen in your calves, your thighs, your buttocks, your lower legs, etc. And just notice when you do things, you're like, oh gosh, I get this cramping feeling, but when you rest, you feel better. Now on to the symptom I was telling you about that can affect men in particular, especially men with diabetes, that could indicate that you have peripheral vascular disease or poor circulation, is erectile dysfunction. Huge, guys. If you have erectile dysfunction, you should be talking to your doctor about your overall cardiovascular health, because remember, erectile dysfunction is tied to our heart health. Okay, I have videos on erectile dysfunction. I'll make sure that I'll DM those to you. Just send me a message if you don't see those on YouTube. I will link those videos to this video. Facebook, just send me a message letting me know you want them. Okay, super important. But erectile dysfunction, especially in men with diabetes, could be a sign that you have poor circulation. Okay, especially in your lower extremities. Guys, this is really, really important. If you have any of those signs, or partners, if you see on your partner some of these signs, make sure you talk to your doctor, because again, you can get tested to see if you really do have poor circulation. You can also, and should, if you do have poor circulation, you can get treated. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Let me know what you think about this video. Please share this video with other people in your life. Hopefully it will help someone else. Let me know if you have poor circulation, if you have peripheral artery or vascular disease, what you do for it, what your doctor has said, things like that. Write that in the comments, because oftentimes what you say helps other people. And then, guys, I am literally on all social media platforms. If you're watching me right now on Facebook, thank you so much. Please like and follow my page if you have not. Guys, for those of you watching on YouTube, hello YouTubers, so great to see you. Please subscribe to my channel, click the little bell for updates. By the way, if I have not said, I do videos literally on all topics, literally from your head to your toe. We talk about sex, we talk about relationships, we talk about mental health, we talk about your heart, diabetes, everything. So you don't want to miss a video. And also, guys, check me out on all other social media platforms. I am on WhatsApp. I have a WhatsApp channel. I'm on TikTok, LinkedIn, Threads, X, everywhere at Dr. Jen Caudle. Make sure you follow me. Guys, I hope this is helpful. All right, I'll see you soon.